comes.
Thanks a million, Fiacre. And I'm delighted to be here on behalf of the group of social workers that developed this project with the IASW. I suppose just before I begin to give a sense maybe of my own background, as Fiacre was saying, I primarily worked within the area of medical social work, mainly in the areas of bereavement, loss, trauma. And I suppose at the start of the pandemic, I was a very frustrated public servant because I wanted to get back into the hospitals. I knew that they would be exceptionally busy. But unfortunately, due to childcare reasons, I wasn't in a position. I was on career break. So when the IASW put out a call to action for volunteers, I had the space within my life, I suppose, to contribute to a broader project, which was new for me because up until that point, my history in advocacy would have been very much organisational based. And I always would have considered myself a strong advocate, but very much, I suppose, within the hospital organisation, representing the hospital organisation rather than representing broader social work issues. And equally, just to say at the start as well, my technical skills would be, I would say, distinctly average, improving with time. I can work my way around most systems, but certainly I'm not going to wow or blind you with my technical brilliance at any point. So just, I suppose, I wanted to start really at the end and show you what we produced. We produced the liaison social work role in nursing homes and residential settings, bearing in mind that people also live, and we forget that sometimes in recent months, within mental health services and within disability services. And what we wanted to do was put a model of practice together for social workers who would be working with residents in those settings. And it built on the work of the new liaison social work service that was set up within a small number of nursing home units, and they were public nursing home units. And what happened basically was that when the mortality rates started to increase in some nursing homes, social workers who had existing links within public units were able to, I suppose, either redeploy or recommend that social workers take over communication care and bereavement care within those services. And through the initial work that we were doing with the IASW and trying to capture how was social work responding, this came through as a very strong theme because the work was absolutely new and it was completely harrowing in terms of listening to the experiences of those liaison, social workers. Bearing in mind that I suppose there's no clinical messages within research in terms of how you support families to grieve for somebody when they can't spend time with them and to experience separated death. So social workers had moved into that space within the nursing homes. We felt that the work that they were doing was making a tremendous difference to the experience of families in terms of, I suppose, preparing people as best you can and alleviating what suffering you can in those circumstances. And we also felt that there was a clear inequality between the experiences of families within the wider private sector in terms of any access to social work services at all. So a group of us came together and we wanted to have a very kind of complete response to the human suffering that was being experienced. And the other piece, as Fiacre kind of alluded to there, was we wanted to kind of challenge that dominant clinical approach that has really been the dominant narrative within Irish life, whereby residents have been viewed as patients and they've been viewed as I suppose through the lens of their clinical wellness or the absence of health. And we really wanted to promote that broader definition of health. And, the World Health Organization's definition of health includes emotional and social well-being. But there's been a feeling within the IASW, I suppose, that has been absent from the discourse to date. So the end goal, and we achieved it, I'm glad to say, after a lot of work, was that we were able to provide this model of practice and guidance, and it's available on the IASW website. And if people have any interest in it, or if people at any point want to come back, have a read, have any suggestions around it, it's very much an organic document, and it's something that we'll continue to review because I suppose, like everything in COVID, it's moving at a rapid pace, things within the nursing home sector. So have a read, and I'm available at any stage if people have questions on it. I suppose in terms of what did we do? Well, we built this remote community and it was across social work fields. So we, within the Irish Association of Social Workers, we had our continuous professional development officer, the fantastic Cliona Murphy, and we had Anya McGarry, our chair, who basically gave their blessing in terms of allowing a group of people come together and build a consensus, a very clear message through our professional body, using our professional expertise to, I suppose, address the need that was identified. And they came from the acute hospitals. We had Amanda Casey from the Mater, we had Kayleen Jackson from the National Maternity Hospital, we had the absolutely fantastic and incomparable Kerry Cuskley in mental health doing some work with us. We had the Hospice and Palliative Care Group from Irene Murphy in Cork. I have to give a shout out to a Cork woman on a Cork webinar, and Niamh Finucane within St Francis Hospice in Raheny. And again, hospice and palliative care patients and services are in very safe hands with those two. Adult safeguarding came late, and I'll talk a little bit about that in terms of our own oversights and our own narrow focus maybe on certain aspects of nursing home care, to the point that we were excluding other pieces. But when adult safeguarding, ably represented by Celine O'Connor, principal social worker, came back and gave us some feedback, we were able to take that on board and adapt the project accordingly. The expertise of the liaison social workers, and I will leave people out because we're learning all the time that different social workers around the country were doing some or all of the role that I'm describing in a variety of units and very quietly. But we had Ashling Coffey setting it up in St Mary's in the Park, and St Mary's in the Park had a horrific number of death rates in quick succession. We had Barbara McDonough and her team in primary care in Dublin 8, and we had Patrice Riley and her team in North County Dublin as well. And then we had the very informed and skilled Sarah Donnelly from UCD, who was kind of coming in again to give an oversight and an overview. So that gives a sense, I suppose, of the people that came together. And what was really interesting was that people brought their professional expertise, but they, we were completely united, I suppose, by our shared social work values, which was a really pleasant experience, because sometimes in professional practice, we often can become quite siloed in our work. And I suppose our relationships with other social workers can relate more to referring on or receiving information rather than actually engaging with their knowledge base. So what really fed this clear message and this model that we were able to produce was certain ingredients, if you like. And if you look at those there, time was one of them. People gave freely of their time, and they gave what time they could. We were very realistic from the outset as to what people could deliver, but it was within their own unpaid time on a voluntary basis. Trust and mindset was huge. I suppose most of us haven't met, and some of these relationships were pre-existing within the IASW. I had never been involved with the IASW. I kind of hopped on this train in March and kind of wondered why I hadn't been on it previously, because the value in kind of building these relationships and bouncing ideas off other people quickly became clear. But we did need to be able to trust each other, and we needed to have a mindset that I suppose everybody had something to bring to the project. Some people had very strong skill sets, and we used those. And that variety of skill set that I've referenced there was really about picking the right people for the right job. So egos were very definitely parked. I didn't volunteer for any radio interviews. I didn't volunteer for anything in relation to the press. We had the very able Amanda Casey, and we had Kerry Cuskley for things like that. I got on with the writing piece. Other people took on the editing piece. The IASW took on the design piece. But I suppose really what kept us in it, because this went on for months, and this went on when people were absolutely up to their eyes. I'm very conscious that I had a little bit of time in between my own kind of personal life here, but I was working with principal social workers who were rearranging, reorganising services, managing or delivering their own services in a completely new way during COVID, and at the same time being very passionate about this project. And it really came from that sense that I suppose the things that are important to social workers and important to the people that we work with weren't being represented at national level, and that dominant patient clinical disease focused model was just very difficult to kind of broaden and to draw out in terms of a more nuanced discussion. So our shared values, our belief in social work, and just our desire to speak up, even on the bad days when we were sick of reading kind of long edits of the same document, kept us going. In terms of the use of technology then, so as I said, all of us, some people are slightly more skilled in different areas of technology than others, but we all brought fairly average technology skills. But what we used them for was probably new connections, new relationships. When you look at the email list there, we were able to introduce ourselves to different people, and within social work, outside social work, we developed the model. We kind of had this round robin thing that would go around between everybody. People would feedback with constructive feedback. Email was really useful to send out to the membership of over 1,300 members in the IASW, and it also allowed us to, I suppose, email journalists, email people within the political system, and we were able to achieve by attaching the model on Morning Ireland interviews and different things like that, and that was actually really, really important, because there was certainly a sense during COVID that you could get access to people that you couldn't normally, and because everything was so crisis and even the media were looking for new pieces of information, we were maybe able to get in at different points. In terms of Twitter, I reactivated a very dormant Twitter account, and I was probably following loads of dodgy celebrities on it before then. I didn't use it in any way, in any professional capacity. So I used it at this point in terms of gaining access to a global and a national social work community, as did we all within the project. It helped us to make connections across social work and across other disciplines. It also helped sometimes colleagues in medicine or other people to kind of speak up and say, yes, this is the value that social work brings. It allowed us represent individual and group ideas. And I suppose one of the things in terms of for social work is that sometimes we're slow to feel comfortable in using social media to advocate, and there's almost a fear there. And we had these healthy discussions within our group about how we use Twitter, and certainly very comfortable using it in terms of any advocacy that the IASW is taking on board. So if they're tweeting something, very comfortable sending a tweet, retweeting. But as an individual social worker, once I'm tweeting something that relates to the core values of our profession, I'm also very comfortable doing that. And if people have a look at my Twitter feed, I've critiqued my own organisation. I'm very passionate about St James's Hospital and the fantastic work that it does. But recently I tweeted that I felt social work was completely absent from the organisational stories during COVID-19. I've asked some questions from the National Safeguarding Office. I think that as social workers, sometimes we're presented, whether it's on prime time or in something else, in the shadows, and we're having these kind of very we're hidden in the corner, and we're speaking sometimes with a voiceover. And like our colleagues in medicine and nursing, Twitter is I suppose, a mechanism to allow us to speak clearly and in line with our values in a way that's quite safe for us to do on a professional level. It also allowed us to tag influencers, engage in the political system. We were able to facilitate us to repeat the same message. So I suppose we were almost presenting a brand, if you like. This is what we feel about how residents in nursing homes are being treated. And it also allowed us, I suppose, to chase media pickup and things like that. One really nice piece was that we released a press release, and I was slightly depressed. We put a load of work into it. We released a press release in April in relation to the unmet needs of the dying and the bereaved. And having listened to some of the harrowing stories from people who were working within care homes, I just couldn't understand how it wasn't picked up. RT Primetime did something over the summer, and some people may have seen it, a documentary highlighting, I suppose, the experiences of families, and some ministers started to tweet about how awful it was to see this. And we were able to say as an organisation, well, hang on, we've told you about this. And we retweeted our original press statement, and other organisations picked that up. And that, again, isn't about social worker having to prove itself, but it's about us building that voice and saying we bring something to the table here. We were on the ball. Zoom there facilitated, as pretty much as we're doing now, another mechanism, human connection, meetings and representation. Okay. So this was very much, I've been calling it kitchen table advocacy from the beginning. The wins related to it was that we now have an evidence-informed practice-based model. I'm actually quite happy. There's things that I would love to go back and do differently on it, and I'm sure that everybody in the group would, but I'm happy that at the time it represented what we knew was best practice in social work. And comparative to other countries, we're ahead of the curve in how we've responded to the nursing home sector issue. We're also ahead of the curve in terms of the national discourse here, and there is historical evidence of that, I suppose, in the press release, and also in the fact that there was just a dearth of research, and those social workers, as I said at the start, that were practicing in the role at the beginning, they had no messages from research to guide practice. Now we're starting to have emerging messages talking about the importance of compassion, the importance of connection. There's been a lot, I've retweeted recently some things from the UK now, people saying that we have to promote the social ties of residents and treat people as the humans that they are, with broad relationships and love in their life that needs to be maintained, and you can't simply cut people off for months at end. We were also able to seek, and this was important, this was the representation on national forums. The HSE set up a psychosocial sector which is operational for about, I think, 4 to 6 weeks. We promoted this model heavily with them, and that was our door opening into getting involved in that. And I mean, it's the battle that social work has, that we weren't invited to be on a steering committee for the HSE psychosocial kind of forum, nor were we invited to the expert advisory group, nor were we invited to the work streams. But this piece of work, which we were able to promote, and eventually promoted through Morning Ireland. And within 5 minutes of that interview, we got a phone call inviting us to that piece. So again, that just shows that one piece of work can be your access to a wider platform, which the International Federation of Social Work is there. And we also made a submission to the expert panel on nursing, and the report was released recently, and some of our thoughts and opinions are reflected within that report, not as much as we'd like, but again, it's about chipping away at that dominant model. We wrote a blog post, Kerry and I wrote a blog post on LTC, which is longtermcarecovid.org, and we've received a lot of kind of international interest. We're having a Zoom meeting with an American organisation next week in relation to learning that they want to, I suppose, adopt from the model, and they're interested in developing the role of social work within long-term care in the US. So again, it's fantastic to think that Irish social work expertise, well, I'd love to say it's dramatically changed the experience of Irish residents. We'll keep fighting that fight, but it's heartening to know that other people elsewhere may actually benefit from the expertise that we're bringing to the table. There's a Beyond the Door exercise within the model, and that was viewed widely on Twitter, shared widely on Twitter, and it was adopted by the Childhood Bereavement Network UK and another separate bereavement alliance as well.
Just 1 minute.
1 minute, okay, I'm done. So opportunities, I suppose. There were new ways of working because there was COVID allowed us to basically work in new ways. Because there was a lack of expert narrative, everybody could kind of put their shoe in. The value of the relationships, they stand. We're still working together on a variety of other projects. And what I really do want to say, though, and I'll come back to the challenges, there were loads of challenges basically at different times, but we worked through them. But the big piece, I suppose, is that social workers really need, for my learning, and I'll put this down as, was that we need to step outside our individual silos and truly embrace what systemic practice means. That if we want to influence change and amplify our social work voice, our professional body is the best way to do that. And it's still hard to be heard at that level, but as individuals or as individuals within organisations, all will change is local practice. Social work have the expertise, and advocacy can be big or small. It can be a retweet. It can be logging onto Twitter and just sharing other people's thoughts if you're not comfortable sharing your own. But the IASW is a microphone. Please consider using it, and at the risk of sounding like a cult, join. Okay, that's me.
Thanks a million. I'm sorry, I was totally engrossed with this. So there's a tiny bit of feedback. But just to say, we're going to be moving on to Peter and Thomas before that, but just there's messages been coming through celebrating the advocacy that has been displayed and the leadership. And Murren in Dublin talking about great to see social workers on Twitter and things like that. We skipped over one slide around the challenges, so that's going to be the one question. What was your biggest challenge, or you think the biggest challenge for you, and how did you get over that?
Honestly, I think it's around communication within social work and having, I suppose, a finger on the pulse of what's happening in social work. I was very conscious afterwards in terms of with adult safeguarding and with our colleagues in primary care that we weren't aware and we didn't capture some of their expertise, which we've addressed since, and it's an ongoing process. But I think that there's something that we need to do nationally in terms of building those internal communication systems so that we can react I suppose in a timely way, and that we can profile social work as it's operational, as it's operational on the ground. So that's a work in progress. And the other thing is just minding yourself. And I know Kenneth is going to talk about self-care, but when you're listening to these stories, I mean, this work is hard work, and the self-care piece is really, really important.